I definitely, with pediatric patients, I feel more of a responsibility because if they're really young, I really, feel like I'm setting them up for life when it comes to their dental work. So it's, again, a lot of care, kind of coming down to their level. A lot of mommy, experiences come into play here, just, with my kids. Really getting down to their level and, just talking to them, befriending them, making sure they see me properly. I think when I kind of present myself with, a surgical cap, a mask, a shield, and gloves, and like just walk in, it's just like anybody would kind of want to run out, let alone a little kid. I try to kind of present myself just, I'm a regular person, any other person. Again, when a stranger kind of comes too close to a kid the first time around, it's nerve-wracking. It's, any kid or any person would be like, all right, back up, this is too close. It's about slowing it down and kind of talking to the, patient. A lot of little kids are actually very open to having a conversation and talking things and making it fun and kind of cracking jokes. And once you create the bond, you can slowly then explain, okay, well, let's, count your teeth. Let's see how many teeth you got in your mouth. What color do you want your teeth to be? Should we color them purple? And slowly from there to what's bothering you? Let's take a look. Can I touch this? It's really a lot more in the, what goes in around the clinical work than the actual clinical work, to be able to create, that proper bond and communication. I had a 3-year-old come to my office, and she had a front tooth broken, and her parents are also my patients, which is why they brought her in. And the father is an extremely nervous patient and very, very scared. He will wait until he is in excruciating pain before he gets work done, which is how we got introduced. He walked into my office and he was in a lot of pain, and he had to get work done. This was it. We had to, do things. And in that appointment, we had to, remove a tooth. And I took my time. I spoke with him. We kind of created, an environment, and it went so smoothly that at the end of that same appointment, he's like, can you do my crown too? I have a crown that I've been putting up. And I was like, well, you just had an extraction, so I think it's better if you come back, take a minute. And he came back, and he got a lot of his work that he'd put up, back and didn't want to do before. He got them done. And afterwards, with, their daughter, again, he came in and he's like, I don't know how we're going to do this. You take care of it. I don't know what to do. And she was the sweetest little thing. As soon as she came into my office, I sat down with her in my, in my waiting room, and we had the cutest little conversation. She held my hand. We walked together to her, to the chair. We talked about, everything, under the sun. And I told them that the tooth needs to come out. And they were really nervous. He was like, I definitely can't be here for this. I'll have her come back with her mom, which is what they did. They came back with the mom. And, again, talking to the patient. We were friends by then, we were just like holding hands and like having, little conversations and skipping through the office. And when she came back and we did the work, she was literally smiling the whole way. The whole time while I was removing a front tooth, she was smiling through the whole thing. And the mom's like, this is not what I expected at all. She didn't need any medication. She didn't need anybody to hold her down. She didn't need like a papoose, which is what a lot of offices unfortunately do to younger kids. And I wasn't doing a simple procedure. She needed to get numb. She needed to, she needed the shot. I had to remove a tooth that wasn't loose. It needed some work to come out. And she didn't feel a single thing. And she was fine throughout the whole thing. She left with a smile, and it was a great experience for everybody around, So it's been probably more than a year since this happened. But like, experiences like this keep me going. It's what, makes me feel like this is what I'm meant to do. Making sure people have that positive experience. I think another thing that really helps is the environment we create here. Anybody who walks in, I feel like I, more or less have said, oh, this looks more like a spa. It doesn't look very clinical. It doesn't look like a dental, place. The music is, very calming. Just the environment, it really puts them in that situation, sets the groundwork for us in a way also, I think.